Welcome to the deep dive. Today we're getting into something that, well, affects all of us. How decisions about healthcare actually get made. And, maybe more importantly, why some really vital health areas seem to always be, underfunded.
Mhm.
It's kind of surprising our research showed that a lot of healthcare innovation is what they call supply-driven,
Right.
meaning it's often based more on what's profitable to make rather than what's most needed by people.
Yeah, like another headache medicine versus, say, tackling antimicrobial resistance.
Exactly. So our mission today is to unpack a new framework that's trying to flip that script, to really zero in on genuine health-related needs.
And that's so important because the way things are now, well, it leaves big gaps. You mentioned antimicrobial resistance, but think about mental health, too. Our sources really point to these areas getting less investment than the need suggests.
Yeah.
It's kind of inefficient how we allocate resources sometimes.
Definitely inefficient. So to try and fix those gaps, those inefficiencies, the sources we looked at introduced this thing called the Need Assessment Framework. That's NEED, Needs Examination, Evaluation, and Dissemination.
Okay.
And the whole point is to give some structure, right, to identifying what patients in society actually need from healthcare, moving towards needs-driven policy and innovation.
Needs driven, I like that.
And it's not just some idea they cooked up. Apparently, it's based on two big literature reviews, lots of consultation with stakeholders, pretty rigorous stuff.
Yeah, and what I find fascinating is how comprehensive it is. It's not just looking at the individual patient in isolation. It breaks needs down into three main areas, three dimensions.
Okay, what are they?
So first, you've got patient needs. That's the direct stuff,
Yeah.
How does the condition affect the person? Think about, like, impact on quality of life. They measure that sometimes with years lived with disability or maybe changes in anxiety or depression levels.
Right, the day-to-day impact.
Exactly. And it also includes the burden of treatment. So side effects from meds or maybe having to travel miles for specialist appointments. That all counts.
Makes sense. What's the second one?
Second is societal needs. This zooms out a bit, looks at the broader consequences. So things like productivity losses, people being off work, the hit to the economy, or how easily a disease spreads, its transmissibility.
Ah, like with infectious diseases.
Precisely. Or even the environmental impact of the usual treatments like greenhouse gas emissions from hospitals or drug manufacturing. It's thinking bigger picture.
Wow, okay. Environmental impact, that's interesting.
And the third is future needs. This is about looking ahead, trying to anticipate what's coming down the line. So estimating the future prevalence of a condition, how many people are likely to have it in 10, 20 years, or the future costs, both direct medical costs and indirect ones, like lost productivity.
So it's trying to be proactive.
Yes, exactly. And cutting across all three of these dimensions is something they call equity. It's labeled a transverse dimension.
Transverse, meaning it applies to everything.
Pretty much. It means you have to look at the data broken down, by different groups, age, sex, socioeconomic status, ethnicity, to see if the needs or the impact are hitting some populations harder than others. Spotting those disparities is key.
That seems crucial. Okay, so we have this really detailed framework, patient, societal, future needs, plus equity. What does this actually do in the real world? How does it help?
Well, the practical uses are pretty significant. Think about policymakers trying to decide where to put health budgets, or research funders deciding which projects get grants.
Or even like drug companies planning their R&D.
Absolutely. This framework gives them a structured way to set priorities based on actual need, not just historical funding patterns or potential profit margins.
So it could guide funding, reimbursement decisions, maybe even incentives for developing treatments for neglected areas.
Exactly that. And it also does something really important. It provides a clearer definition for unmet medical needs.
That term comes up a lot, but it always feels a bit vague.
It has been vague. Despite being really important in regulations, like in the EU's pharmaceutical laws, having a clear, structured definition, like the one NEED provides, could make those regulations work much better.
Okay, so it sounds powerful, but are there any limitations, things that might miss?
Yeah, that's a fair point, and the source does mention some things. Because it's largely focused on specific diseases, it might sometimes overlook broader health issues that cut across many conditions.
Like what?
Well, think about environmental factors like air pollution that affects asthma, heart disease, lung cancer, lots of things. Or a really strained healthcare workforce that impacts care for everyone, regardless of their specific illness.
Right, systemic issues.
Exactly. Those transverse issues might not be fully captured if you're only looking disease by disease. So it's a great tool, but maybe not the only tool needed for the really big picture.
That makes sense. It's a significant step forward, this need framework. Definitely seems like a move towards a more targeted, patient-focused and societally aware healthcare system. But good to keep those broader issues in mind, too.
Absolutely, it sets a strong foundation.
So wrapping up, the need framework really offers a structured way to understand health needs far beyond just individual symptoms.
It does. It pushes us to think about patients, society, the future, and equity all together.
A really valuable perspective.
So maybe something for you, the listener, to think about. If healthcare investments really were perfectly aligned with the most pressing needs, patient needs, societal needs, and not just profitability, what kind of changes, what breakthroughs, what improvements would you hope to see? Something to mull over.